So this is a technique for Hallux Valgus. It's an indirect mechanical technique, a kinematic technique, just aiming to resist the lateral deviation of the big toe. Very simply, in first principles, we can just apply it to the toe. Just bring them into the shortened position, and then down. It's often good to just come through the arch, just to resist a bit of that dropping of the arch, which is often associated with this, and then around the heel. Now remember, you might also be looking at doing some other techniques, the external rotation of the hip, or perhaps a tibialis posterior type technique to address the mechanics that are leading to that. But we can see now how that's resisting that lateral deviation and keeping the toe a little further into adduction. A variation on this is to use approximately 2/3 the width of the tape, and we can start to bring in some fine tuning. Now just take care when you apply this, because the same position of the tape will give you the opposite result. So if we actually start medially and then come around, we're going to pull the tape up and across the foot, whereas if we the toe rather, whereas if we actually keep the same position but start on the lateral aspect, we can actually pull the foot up and out to where we want it. So as we wrap around the toe, again bring them into the position you want, so into that shortened position, through there, and then again wrap up under the foot and around the heel. And again, that will bring them out into some degree of varus. Now, you may also find, as a pain relieving technique, if they weight bear on their toe and they're painful, you might want to try varying degrees of rotation. So as they weight bear, you assess their pain, you get them to ease their weight, then you may rotate one way or the other and see if that eases their pain when they apply their weight again. If it does, you can apply a technique to mimic that, just by starting on the toe, and then we can pull them into rotation in this direction, as well as into varus. And alternatively, if the other direction was the pain easing direction, we'd rotate them the other way.